All right, so diving in here to nutrition and hydration, chapter 8 of the Hartman slides. A nutrient is the necessary substance that provides energy, promotes growth and health, and helps regulate metabolism. Nutrition is how the body uses food to maintain health. Important to remember here, a well-balanced diet will help residents maintain muscles and skin tissues and prevent pressure ulcers. All right, there are 6 main types of nutrients. The most important is water. Second, I would state the second and third, carbohydrates and proteins, are incredibly important. Those are both nutrients that we need to make cells. The fourth listed here is fats. Fats are what make up our cell membranes, so we absolutely need fats to make new cells. Vitamins and minerals are also very, very important nutrients. Water is incredibly important. It is the most essential nutrient for life. It aids with digestion, absorption of foods, elimination of wastes, and maintaining normal body temperature. Our bodies are composed primarily of water. Carbohydrates and proteins are incredibly important. Carbohydrates provide energy and fiber. The only way that we can get fiber in our diet is from carbohydrates. There are 2 different types of carbohydrates. There's complex, and that's going to be things like bread, cereal, potatoes, rice, pasta, many of our vegetables and fruits. A simple carbohydrate, alternatively, is just one single, it's like a sugar. To get those complex carbohydrates, it's 2 sugars that are bound together. It takes longer for your body to digest because it has to break those sugars apart before it can use them, which is why they're better for you. Simple carbohydrates like sugars, sweets, syrups, and jellies, those hit your bloodstream extremely quickly because your body can digest it really, really fast, which is why those are the types of foods that are difficult, especially with type 2 diabetes. And then thinking about proteins, there's 2 types of proteins. There's animal comprised proteins as well as plant comprised proteins. Typically speaking, your plant proteins are going to be the best for you. And there are a lot of plant derived proteins made, like in tofu with soybeans. That's a very, very useful type of protein, and that is an animal protein. Proteins are vital for growth and tissue repair. They do supply a good amount of energy. So, types of animal proteins, that's going to be seafood, poultry, eggs, meat, milk, cheese. Your animal proteins, those are nuts, nut butters. Peas are incredibly high in animal protein. Dried beans, legumes, and of course tofu. That's a very, very important one. Fats. Fats are also incredibly important. I mentioned that they are what makes up all of our cell membranes. We absolutely need them. We store fats, obviously, on our own bodies, and that is kind of a reserve for energy in moments where we don't have enough energy from our diet. Fats add flavor to food. They are important for the absorption of 4 different vitamins. A, D, E, and K are all fat-soluble vitamins that we need fat to digest. They are also difficult vitamins, or not difficult, they can be hazardous if you consume too much of these fat-absorptive vitamins, A, D, E, and K. You can overdose on them because your body cannot eliminate them, as well as vitamins B and C, which are water soluble. Two types of fats here, or there's 4 types of fats. 2 of them are healthy. Mono unsaturated and poly unsaturated fats are healthy fats. Those are good fats. Those are the kind of fats that are liquid at room temperature. Saturated fats, things like butter, those are not a liquid at room temperature. There's another component on the end of the chemistry chain of what makes that fat a fat. Those are harder for your body to digest and more likely to be put into storage on our bodies. Trans fats are also incredibly bad for you. They are no longer really allowed. The FDA has kind of made them kind of illegal because they're really bad. They are not, you cannot digest trans fats for use in the body. They are just incredibly bad. They used to be used primarily in restaurants and fast food, as well as a lot of pre-prepared foods. Fats are high in cholesterol, which is, cholesterol is not particularly good for your body, especially for the average American. So keeping that in mind, any consumption of fats is, overconsumption of fats is bad for you, but you do need a certain amount of fats in your diet to survive. Vitamins are essential to body functions. Many of these cannot be made with our body, so we need to consume them through food. Fat-soluble vitamins, vitamins A, D, E, and K, those are only absorbed through fat, and you can overdose by taking too many of them. Water-soluble vitamins, vitamins B and C, those are absorbed through water. Your body will excrete them when we're making urine. You can take as much of it as you would like and not overdose, but I would not recommend doing that. But that's kind of an important note, especially when you're taking vitamins and supplements, to be aware of. Minerals help the body to form bones, blood, and hormones. They provide energy and maintain bodily functions. Many of them are referred to as electrolytes. These include zinc, iron, sodium, potassium, calcium, magnesium, and phosphorus. These are important with how our cells function. The U.S. Department of Agriculture developed MyPlate, which is an incredibly useful resource. You can go on their site or download their app for your phone, and you can look at different types of vegetables, fruits and grains, proteins and other foods, and really do a deep dive into what vitamins are there, what minerals are in there, kind of just recommendations, as well as recipes. You can find recipes on there that are really, really good. This picture here is proportionally correct for what your recommended dietary intake makes up. So fruits and vegetables should be half of what you're eating. Keep in mind that different colors in different fruits and vegetables almost directly correlate to different types of vitamins. So I like that they used all these colors here, because having a diet that's full of natural colors, not added colors, of course, means that you're consuming a good variety of different vitamins, which is incredibly important for good health. Over here in the corner, of course, we have our dairy. They recommend that you consume a diet that has 1% dairy fat, so like 1% milk, or low-fat dairy products. We do not recommend that adults are consuming a 2%, like 2% milk. That's a higher fat content in dairy than is recommended. When it comes to grains, you want to be looking at whole grain foods, foods that are not whole grain. are not as good for you because they do not have any dietary fiber in them. They've been removed. The endosperm portion of the grain itself is no longer part of the equation. So it's all the bad stuff about carbs, but none of the good stuff. Proteins, plant-based proteins are the best ones for your body. They don't taste as good, but they're the best ones for your body. A diet high in plant-based proteins is a good thing. Though it is important to note here that with plant-based proteins, they're not an animal protein, so it's not a direct one-to-one as you're digesting it. And so you have to to make the best use of the proteins that you're eating, they need to be combined with things that have the rest of the remaining components. So things like beans and rice together are enough for your body to make a protein. Peanut butter and bread is another one that you should consume together because it's a direct, everything in your stomach is right there for you to use those amino acids and make a full protein with them. Other ideas for making healthy food choices. Balancing your calories. Enjoy your food, but don't overeat. Your body cannot use the rest of those calories and they end up immediately in storage. Consuming foods that are low in solid fats like butter. Those healthy animal fats are always, those healthy plant fats are always going to be better for you than those animal fat sources. Avoiding overly processed foods that are high in fat and salt is also a good thing. Foods like hot dogs and cheese, bacon, fried foods, ice cream, these things are not so good for you. And pay attention to the added sugars on the nutritional label. Those added sugars that you find mostly in juices and sodas are very, very bad for you. They are not like good carbohydrates. Those are your simple sugars. So keep an eye on the ratios there on that nutritional label. How many grams of added sugar is added to something. And then of course drinking water. Drinking water is so much better for you than drinking anything else. So lots of water intake is very healthy. As CNAs, we need to be mindful and watching what our residents' food preferences are. That's a huge portion of autonomy, and it's going to help with kind of healthy nutrition and appropriate weight gain if we are trying to promote that with our residents. Asking questions is a good thing. If you don't know what that resident prefers to eat, ask them. They're going to know more about what they want than you do. Residents have a legal right to make choices about their food or refuse food, and we must honor their beliefs and preferences. It's important also to remember that regional, cultural, and religion play an impact in what kind of foods we eat, and that's kind of part of their identity. So our patients that are moving into a long-term care facility are already losing so much of their autonomy, and we can support them best by providing them with what they want. Therapeutic, modified, or specialized diets, those are doctors ordered diets for people with certain illnesses or conditions and food allergies. A pureed diet is an example of one of these modified diets, and that is where food is blended or ground into a thick paste or like a baby food type consistency. This is what we're doing for our patients with poor dentition or having trouble kind of clearing their oral cavity after eating. Special diets are often ordered for residents who have a certain illness or condition. Sometimes they are ordered to help a resident gain or lose weight. Some diets are ordered for a short time before a medical test or surgery. So different types of diets that we might see for congestive heart failure, which we talk about a lot. That would be a low sodium and low fat diet. For a resident to lose weight, that's going to be a calorie modified diet. And then for diets before surgery, typically that's going to be an NPO or a nothing per oral type diet, and that's so that during surgery there's less of a risk of that patient aspirating while they're on the table and breathing in their stomach contents. If by accident a resident gets the wrong tray, this can be life-threatening if it's a food allergy, but it can also just be inappropriate. Like we were just saying, for a patient that is about to undergo surgery, if they do regurgitate when they're on the table and breathe in those stomach contents, that can mean that can be almost deadly for them. They're going to be dealing with infection in their respiratory system. So it is super, super important that when you're handing out trays, you're comparing the resident's name, date of birth to the tray. And if it's a patient that has Alzheimer's, you're going to be asking them for them to say their name, not, is your name Susie? Because they may be confused by the question or not understanding what you're saying, and they say yes, and it's the wrong tray because they're really Sally. Some of the diets that we might see here, a low sodium diet, that's going to be for our cardiac and our renal patients, our kidney failure patients. A fluid restriction diet, and the same animal, that's going to be our cardiac and our kidney patients as well, because they can't eliminate the fluid that's already in their body effectively. A low protein diet, a low fat diet, a modified calorie diet for somebody who needs to change their caloric intake to either lose or gain weight. A diabetic diet, those are going to be your complex carbs and low carbs, rather than having sugars that are going to hit your bloodstream and make your blood sugar rise. A vegetarian diet for people either by preference or by necessity can't eat meat. A vegan diet does not have any kind of animal or animal byproducts in it. A pescatarian diet, a full liquid diet is one that you see a lot with gastrointestinal or stomach problems, where they'll start somebody on a clear liquid diet, so things like water, Jello, cranberry juice, chicken broth, so only liquids that you can see through. A full liquid diet is going to just be foods that are a liquid in general. A soft or mechanical soft diet might be prescribed if somebody has difficulty chewing or clearing food out of their mouth after eating. And a pureed diet as well. That's going to be everything that has been blended or ground so that it is no longer needed to be chewed. NPO is an abbreviation of a Latin phrase, so that's kind of difficult to kind of come up with a good way of remembering. I like to think of it as nothing per oral or nothing passing oral, but it essentially means nothing by mouth, and this includes water. Dehydration is a serious condition that results from inadequate fluid in the body and can be really difficult for our seniors to recover from. Drinking enough water or other fluids each day can help prevent constipation, urinary incontinence, and dehydration. This can be tricky for students to wrap their head around, but urinary incontinence can be caused by being dehydrated. So that's another reason why it is so important for us to push fluids for our seniors, because they just never seem to drink enough water. It can be helpful for some of these patients to encourage other types of fluids rather than just water. A lot of people don't like the taste, or they just don't prefer water as a beverage. So things like water, low sugar fruit juices, things of that nature. Making sure that water is available in your patient's rooms, especially in the hospital or long-term care settings, is a good first step to battling dehydration. And so, in some cases, taking a good look at your patients and thinking, do they need help with drinking water? Are they having trouble with holding the cup or with aspirating? And offering assistance can help. A patient that is on an NPO order, remember that's nothing per oral, cannot have any food or anything to drink, and that includes water. So things to report that can be signs and symptoms of dehydration is obviously increased thirst, kind of a trend of not drinking enough fluids with meals, needing help drinking from a cup, having trouble swallowing fluids, or experiencing fatigue or weakness. Another sign is going to be being lightheaded or dizzy when standing. It means that there's not enough fluid in your arteries and veins, and your blood pressure drops when you stand up. Other signs and symptoms to keep an eye out for: having a dry mouth, cracked lips, sunken eyes, dark urine, strong smelling urine, weight loss, and that would be water weight loss, dizziness, complaints of abdominal pain. Having an episode of vomiting or diarrhea can also cause dehydration because you're losing all of that fluid that would otherwise be absorbed in your body. Confusion can be another sign of dehydration. Fluid overload, that is a condition in which the body cannot handle the amount of fluid consumed, and so that fluid is not excreted when we're making urine. Edema is another sign of fluid overload, and that's those leaky arteries and veins. When that blood is not moving out of the arteries and veins, they leak out into the tissue, and it can cause excessive fluid in body tissues. You see this most often in the feet and ankles, or anywhere that gravity is really pulling all of that fluid to. The answer to this is, of course, true. It's important with our patients that are prone to fluid overload, like our cardiac patients, to keep an eye out for the swelling of extremities, like in our feet and ankles. Any gain in weight, especially rapid weight gain, is typically going to be water weight. A decrease in urine means that we're not producing enough urine to eliminate that water from the body. Shortness of breath, that can occur when you have fluid building up in the bases of your lungs, and that happens a lot with our cardiac patients. An increase in heart rate, anxiety, tight, smooth, or shiny skin. This means that the skin is being pulled tight with the increased volume of fluid against it. In extreme cases, you'll see the skin weep as the integrity of the skin is damaged by that added pressure, and the fluid will literally weep out of the skin. It's important that you report any weight loss in a resident, no matter how small. Our elderly, in particular, our dementia elderly, are prone to weight loss as they have trouble with chewing and eating, as well as decreased hunger. We can help to prevent unintended weight loss by assisting our residents, keeping tabs on how much they're eating. If they have an order from a doctor for a diet, that doctor is intending that they eat 100% of their plate. If they are consistently not eating 100% of it, it can be the sign that weight loss is coming, and we need to be keeping an eye out and reporting that to the nurse. If the resident reports mouth pain or dentures that are not fitting very well, weight loss can cause dentures to not fit well. If it hurts to eat, you may be less inclined to eat. And a modification to that diet, like making it a mechanical soft or a pureed diet, might fix that. Do keep in mind for testing purposes and for life that as the CNA, we are not changing a diet or changing a fluid order for a patient. That's going to be done by a doctor only. Not even the nurse can do that. But it is important that she or he has that information to relay to the doctor. If a resident is coughing or choking while eating, we're thinking aspiration, and that can really cause a lot of problems, but weight loss is definitely one of those. On the topic of aspiration, we need to keep in mind that it is very hazardous to try to consume fluids when we are not sitting upright. It's very hard, especially for our seniors with dementia or somebody who's had a stroke or any kind of muscle weakness, to swallow in general. And if we are not sitting upright, that fluid is more likely to end up in our lungs. When we go to swallow, it can go directly into your lungs rather than into your stomach where it's supposed to go. It's also important to think about, as a society, how we approach food. Most social gatherings are environments in which food is present, and it's kind of the center point of that social engagement. So we spend our entire lives growing up, attending a birthday party. There's always food there. There's going to be birthday cake. A family reunion is going to oftentimes be a potluck or a gathering where there's food present. Getting together with friends. If you're getting together for a social arrangement, you're most likely meeting at a coffee shop or meeting over dinner or lunch. We center most of our social engagements around food. And so adding that component and meeting that need for socialization while your patients are eating can help with encouraging them to eat. We need to do for our patients exactly what we do for ourselves when it comes to getting prepared for a meal. So we want to be assisting with grooming and hygiene before dining. Oral care is incredibly important. If you imagine that you've not brushed your teeth in over 24 hours and you need to sit down and eat something, it's not going to be very appetizing to be eating. So we need to be offering that oral care prior to meals being delivered. We also need to have that person go to the restroom before they go and eat. If you are, needing to go to the bathroom, you're less inclined to be eating. Keep an eye out for dentures that are poorly fitting, eyeglasses that are in need of repair or a new prescription, and hearing aids as well, to encourage the sensory aspect of eating. When assisting with feeding residents, we need to be aware that residents have different levels of needs for help. Some of them are going to be able to feed themselves and will prefer to do so, while other patients will need to be fed. This is where we use that hand under hand here to promote that dignity while feeding. Always encourage your patients, your residents, to do everything that they can. The longer that they are doing things for themselves, the longer that they will be able to keep doing things for themselves. When feeding somebody, it's important that you assist with those elimination needs prior to meals, like taking them to the bathroom. Wash their hands before. This is just a safety and infection control precaution, as well as a dignity thing. Identify your patients always before serving meals. Sit at eye level. It's very intimidating if you're standing over somebody for the person. And if they're feeling intimidated or uncomfortable, they're going to be less inclined to want to eat. We're always we're always going to be protecting their rights and their wishes. So if they want to pray before a meal, that is something that we are going to, encourage and allow for. We never instill our own beliefs on patients. Never touch their food. This includes blowing on their food. That's incredibly rude. Imagine having a waitress blow on your food before putting it in front of you. I know I would not want to eat it. I don't think your patients would want to either. When visual acuity is an issue, identifying the foods and fluids in front of the person may help, as well as for your patients that have dementia. Their sensory system is inhibited or damaged in that way, and so just orienting them that the food is now in front of them can help. It's always good to be social and friendly as well, and give them your full attention if you're feeding them. If you were in that position, you would want your CNA to be paying full attention to you as well. Also make sure that you're offering something to drink in between bites. This can help to clear that oral cavity, as well as keeping that oral cavity moist enough that food's not getting stuck. On the topic of clothing protectors, this is something that you see a lot in the skilled nursing and assisted living environments. These are optional for patients. You do not force them to do so, and you never refer to it as a bib, because adults don't use bibs. They use clothing protectors. Children use bibs. Dysphagia is a term for difficulty swallowing. It's like, think of dys as in dysfunctional, so dysfunctional. Phagia, that is the term for eating or swallowing something, eating something up. So dysfunctional swallowing or difficulty swallowing. The following can cause dysphagia. First and foremost is stroke. When you're swallowing, it is a series of muscle actions, and they need to happen exactly correct in order to not aspirate. When you have a stroke, it affects the muscles in your neck in many cases, and this is going to cause a risk for aspiration and difficulty with swallowing. Head and neck cancer, of course, can also play a role in this. Multiple sclerosis, we talked about this in the previous chapter, but that's where those neurons are firing, and they're kind of just short-circuiting, for lack of better terms. So they're having difficulty with shaking, controlled movement, and controlled swallowing. Parkinson's, of course, that's a decrease in motor ability and muscle movement, which it makes entirely logical sense that they're going to be having trouble with swallowing because they do not have controlled movement in their neck muscles. And Alzheimer's disease, of course, is another risk for dysphagia. It's incredibly important to report to the nurse if you are noticing that your resident is having coughing fits during meals, or is choking or aspirating during meals. Excessive salivation can be a problem. Signs of aspiration can be just a gurgling sound during meals in that person's voice, eating very slowly or avoiding eating, spitting out pieces of food or swallowing a lot, clearing their throat frequently or having watery eyes, food or fluid coming up through their nose, or a visible increased effort to swallowing. These are all signs and symptoms, especially if it's a change. We always report a sudden change with a patient, but these are all things that you need to tell the nurse. In many cases and situations in which a resident is aspirating, we need to consider thickened liquids, which is, again, a doctor's order. So usually the first sign of getting that put into place is telling the nurse. Thickened liquids are going to be things that have obviously been thickened, which is going to prevent the spillage or the accidental spill of water or something thin going into the lungs. There are several different thickness categories. The first is going to be nectar thick, and that's going to be the consistency of tomato juice. Honey thick is exactly how it seems. It's going to be the thickness of honey. And pudding thick is going to be the thickness of pudding. So the doctor, the speech therapist, will be the one that determines what thickness it needs to be, but the first step, of course, is letting your nurse know, because you are often the eyes and ears of the operation, even though it may not seem that way. This is a framework for thickness and categorizing thickness, which is just kind of important to remember that this acronym is kind of how this is determined, the name of this framework. Always position your patients in a straight or upright 90-degree angle for eating or drinking, but for testing purposes, just as upright as possible. Always offer small bites of foods or small spoonfuls. This is going to help to prevent the risk of aspiration by not being an overwhelming volume to swallow. Always feed the resident slowly. Go at their pace. We're very busy as CNAs and we don't want to be slowed down. We've got a lot to do, but feeding a resident too quickly can cause them to aspirate. If the person has had a stroke, always feed on the unaffected side of the mouth. Always make sure that the mouth is empty before offering another bite. It is also incredibly important to keep that person upright for at least 30 minutes after eating and drinking. The vast majority of your stomach contents will be emptied into farther down the system after 30 minutes and will significantly decrease the risk of aspiration, of regurgitating and then aspirating that stomach contents. Parenteral nutrition, this is a type of nutrition that bypasses the stomach entirely. As we are consuming food, it's being absorbed through that gastrointestinal wall into our bloodstream. That's how blood sugar happens. That's how everything is metabolized, or the process of metabolizing and digesting and absorbing that into our body. Parenteral nutrition is something that I've really only ever seen in the hospital setting, but you're essentially being fed by having all of the types of nutrients put into your bloodstream and not having to go from your stomach into your bloodstream. A nasogastric tube, that you will see much more frequently. This is where a feeding tube is inserted through the nose and deposits food directly into the stomach. So this is a great example of keeping your patients upright for those 30 minutes afterwards. If you have somebody on a continuous nasogastric feeding where they're being fed through that tube, you want to ask the nurse to turn that tube off before you're laying that person down. Otherwise, it's the same as taking a sip of water and then just laying down immediately. The risk of regurgitating is catastrophic. Percutaneous endoscopic gastromy, that is a more permanent version of a nasogastric tube. It's called a PEG tube. That's what the acronym for it is. And this is where a hole is inserted through the abdominal wall directly into the stomach, so that you can feed somebody without having that nasogastric tube in their nose, because that can be very irritating in a long-term environment if that person's going to kind of forever need to be fed this way. The gastromy is, think like ostomy. It's just a hole. That stoma, that word stome, is the abbreviation or the shortened word for the hole going into and out of the body. So gastro, stomach, stoma, hole. So it's a hole or an opening that goes into the stomach where they have that inserted tube to do that feeding. If a person's digestive system does not function properly, that's that parenteral nutrition. That may be ordered. With this type of feeding, the solution of nutrients goes directly into the bloodstream. If a person can digest food but cannot swallow, they may be fed through a nasogastric tube, an NG tube, or a PEG tube, percutaneous endoscopic gastrostomy tube. Important to mention here, as I say, you're the eyes and the ears. Your role with tube feedings is to observe for problems or any changes in the resident, and then let the nurse know if you're noticing something. As CNAs, we never insert or remove tubes. We do not initiate the feeding. It's an order, so that is exactly like giving a medication. And we never clean the tubes. That is the nurse's role. You are there to observe and assist assist the patient. Residents with certain conditions or diseases such as stroke, Parkinson's disease, Alzheimer's disease, or other dementias, any kind of head trauma, blindness, or confusion, they may need additional help with eating, and that's why we do that hand over hand or hand under hand technique rather than just a traditional feeding, because that can be really, really, well, embarrassing for the patient. It's harder to eat that way, and it's very undignified for an adult to be fed that way. So that's why we use these hand over hand, hand under hand techniques when feeding. Always good to use those assistive devices with eating. Use those physical and verbal cues, putting food on the stronger side of the mouth. And for residents with that vision impairment, imagine that plate as a clock and tell them what time each item is at. They will otherwise not know. All right, and just to bring this point home again, this is that hand over hand technique that is referenced in the Hartman book. All right, thanks for listening. I hope that this recording is helpful for you as you're preparing for your exams. If you have any questions about anything we covered, please text or email me, and I'd be more than happy to fill you in. All right, thanks. Have a good day.